Hey guys, it's Crystal from livingwithgastroparesis.com, and it's time for another FAQ Friday. So today we're going to talk about something that I get a lot of emails about, a lot of people ask about it on my Facebook page, and that's Botox for the treatment of gastroparesis. Now when you think about Botox, you probably think about celebrities and cosmetic procedures and that frozen face. Let me tell you a little bit more about what Botox is, why it's used for gastroparesis, and how it's used for gastroparesis. And then we'll talk a little bit more about the efficacy, the results, and the experience of other GPers. So Botox, it basically paralyzes muscles by blocking the nerve impulses that cause them to contract. So for gastroparesis, it's injected into what's called the pyloric sphincter, and that's the sphincter between the stomach and the duodenum. The duodenum is the first part of the small intestine. So the pylorus is the muscle between the stomach and the small intestine. And so Botox is injected into the pylorus, and the premise, the idea, is to kind of paralyze that sphincter open, so that by gravity alone, food will empty more quickly from the stomach into the small intestine, therefore speed up gastric emptying, therefore decrease the symptoms of gastroparesis. That's the idea, okay? It's done via endoscopy. So if you've had an upper endoscopy before, Botox is done the same way. You're sedated, you don't feel anything, you don't know what's going on, you won't remember anything, and your doctor will go down with a scope and they'll inject the Botox directly into the pyloric sphincter. So it's not a painful procedure. It's, like I said, no different than a normal upper endoscopy. In terms of results, okay, it's all over the place. If you talk to patients, if you talk to other gastroparesis patients, you'll find kind of a 50-50 split in terms of people who say, yes, it helped, and no, it didn't help. Based on my individual clients, the people I work with in group programs, the literally hundreds of GPers at this point I've talked to, it seems to be kind of 50-50. The medical literature supports that. And actually, the results from the studies are even a little bit lower in terms of the efficacy. So most of the studies that have been done with a very, very small group of participants. The largest study that I have read had 63 participants, and about 42-43% of them noticed an improvement in their symptoms. So, a little less than 50-50. And they have demonstrated that Botox injections do seem to speed up gastric emptying, but the symptomatic response doesn't always match that, okay? So about, a little less than 50-50 in the studies that have been done. It's also worth pointing out that they've looked at the difference between injecting Botox and injecting saline, and there hasn't been much of a difference in terms of symptomatic response. So there may be somewhat of a placebo effect going on here. Obviously, if you get relief, you get relief. It doesn't really matter if it's a placebo or it's the medication, but in terms of the efficacy of the Botox itself, they haven't really been able to demonstrate that it's any better than saline. In terms of the duration of benefit from Botox, it's not a one-time thing. So you don't get one Botox injection and then you have ongoing relief. The study that I referenced with the 63 participants, they found that the average duration of relief was about 5 months. So it's the kind of thing where if it's helpful for you, you do have to periodically get the injection. So I know people who go every 6 months. I know people who go once a year. And they do get ongoing relief, but they have to continue getting subsequent injections. I will tell you personally, I did have the procedure done twice. The first time I noticed pretty significant results. It was about 5 years ago. And at that time, I did not know that I would be sharing all of this with so many people. So I I didn't keep, very good track, but I do know that we went on a cruise a couple of weeks after I had the procedure, and my symptoms were definitely better. I was able to eat more. I remember eating salad on the cruise and feeling pretty darn good. So my results only lasted about 2 months. At that point, they had worn off. My doctor did a second Botox injection, and I didn't really notice any relief from that one. So that was kind of the extent of my experience with Botox. Having said that, though, I think for those 2 months that I did experience relief, it was worth it for me. And so that's a really personal decision that you have to make, and you have to talk over with your doctor. Is a couple of months of relief worth the procedure for you? I will say that based on what I've read and based on the people that I've talked to, there isn't a lot of evidence of adverse effects. So it seems to be pretty safe, but can't really guarantee the efficacy of it. They've yet to really figure out why it seems to work for some people and not for others. There's a thought that if there's some factor of pyloric spasms, right? So if that sphincter we talked about is spasming, and that is contributing to the delayed gastric emptying, then of course the pyloric Botox injections might be more beneficial. I've read estimates of about 60%, so about 60% of GPers might have some aspect of pyloric spasms going on, but they really don't have a good way to tell who will and who will not respond to this treatment. And so because they've had so little success really demonstrating efficacy, certainly some small studies have shown it to be very helpful, but they haven't been able to do any larger studies. They haven't been able to kind of repeat those results. So there are many doctors who do not do Botox injections. I'm sure there are probably lots of doctors who are not even aware that it's a possible treatment for gastroparesis. So if you don't see a motility specialist, you see a general gastroenterologist, and you might be their only patient with gastroparesis, they might not even be aware that this is a treatment option, and it's something you might need to educate them about. You might need to be proactive and ask about. And there are still doctors who do perform the procedure and are happy to perform it just based on the response that their patients get. So it's still considered an off-label use for Botox, okay? And so some insurance companies will not approve it. You might need to appeal. Your doctor might have to write a letter. There can definitely be some hurdles in getting the procedure. But for some people, it's worth it, and for some people, it proves to be pretty effective. So it's definitely a personal decision. You have to weigh the kind of 50-50 odds of it being effective. But hopefully this gives you at least enough background information about the procedure, about the theory behind it, to help you make an educated decision and to help you take this information to your doctor and talk it over with your doctor and decide what's best for you. So thanks for joining me. Let's keep this conversation going over on my Facebook page. If you've had Botox injections, I'd love to hear about your experience. Come over to facebook.com/livingwithgastroparesis. And if you like the video, if you thought it was helpful, please share it. And I will see you next Friday for another FAQ.